low back pain. It's something that virtually every single adult will suffer from at some point in their lives. And if they toddle or crawl along to their doctor, the doctor doesn't have any solutions. And what he does offer doesn't work and can even make the situation worse. For example, many is the doctor who says, bed rest. Bed rest is the worst thing you can do for chronic low back pain. Or they'll maybe suggest a strong painkiller, injections, or even surgery. And they've done a big review of that quite recently into all the conventional ways that they are addressing chronic low back pain. And they found, guess what? None of them work. Not one of them. And the trouble is that sort of doctors know that as well. And the real tragedy is, as these researchers from Warwick University found, is that doctors are set along a very strict paradigm of treatment. They are controlled and they are regulated. And they must follow those protocols very, very strictly. It almost doesn't matter if the patient dies, but just as long as you follow the protocols and the agreed treatments, you'll be fine. But if you wavered off that path and successfully treated the patient, you are actually could be in trouble. And so this is the problem. So they said, well, that we do know there are things that can help chronic back pain, and one of them, for example, is acupuncture. But any doctor who suggests this as a possible treatment, he just wouldn't dare. It's not one of those agreed, so-called proven treatments that he can turn to. As I said, his hands are tied by what they call best practice guidelines.
And I think, even, as you say, even doctors, there is a well-known orthopedic surgeon, really renowned, in Glasgow, called Gordon Waddell. And he wrote about this, and he said, essentially, of all back pain patients, doctors are able to deal with 4%. 4%. And the rest are essentially fall into the category of disaster and failed back. And that really, what tops the list is surgery. He found that in most cases, doctors, when they do surgery on backs, make things worse. So one of the big secrets about back pain that increasingly new forms of treatment are recognizing is that it doesn't have to do with the bones. The bones just sit there. And the only thing that moves those bones are muscles. And they find that imbalanced muscle patterns, inbuilt and ingrained muscle patterns that are reinforced all the time by the brain, oftentimes are the real cause. And when they're dealt with, and increasingly more systems like Feldenkrais and Egoscue and many other systems like that Mitchell Yass is treating patients too, many people like that are really focusing on muscle rehabilitation. And when they do that, the person gets out of pain.
And the researchers say, look, carry on being active. It's the best thing you can do, even up to and including bending and lifting, as long as you do it properly and don't, bend your back and so you lift from the hips and knees. And in fact, may even speed recovery. So they said if you must take painkillers, okay, understood, but be careful. It's the road to opioid painkillers, and you've got to be very careful with that. And they said the only people who really should overly worry about low back pain are if you suffer from problems passing urine, or impaired sexual function, or feeling numbness in the genitals or buttocks, loss of bladder or bowel control, or loss of power in the legs. Then that could be serious and could mean something else is going on. Otherwise, stay active, don't stay in bed, and find the nearest acupuncturist because the doctor can't do it.